Here's the thing that I think overactive bladder causes more distress in people's life than stress urinary incontinence, partly because it's so much more out of our control. Most of us can kind of tell when we're about to sneeze or cough, and maybe we don't do that very often, but overactive bladder comes without any warning at all. And I've had many, many patients tell me very embarrassing stories about being in Publix. You get there and they had just this accident and they literally had to turn around and go back home. Or they're on their way to the doctor's office and a lot of people come an hour away and they have to stop 3 times before they can get here in an hour drive. So it interferes with the way people live their lives. So it's a major reason for people to become shut-ins because they just don't want to deal with it anymore. They don't want to go out, they don't want to have to take extra pads, they don't want to take a change of clothes. It decreases physical activity. I have a lot of people who don't go to the gym because of it or don't exercise because of it. And then that starts a spiral of other things. Then your health isn't as good, and then your blood pressure's not as good, and your diabetes is not as good, and then you're less mobile. And we know that as you start becoming less conditioned, other problems arise, and then your quality of life goes down. Decreased self-esteem. It's not very flattering, to have an embarrassing situation. It also affects, for example, we live in a warm climate. We have beautiful weather and beaches, but a pad doesn't look very good under a bathing suit. So I know a lot of people will avoid going out on a boat or going, sitting around at someone's pool for a pool party just because they don't want to be put in that situation. People also don't travel. I've had many patients tell me that they just can't endure the plane ride, the time that they are not allowed access to the bathroom because of their overactive bladder.